Greetings. I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's December 2021 issue. There are 3 articles that have been selected as our editor's choice or highlights articles in this month. The editor's choice this month is an original article entitled Anti-Diabetic Effects of the Senolytic Agent Dasatinib. It is authored by Dr. Omid Salami from Duke University in Durham, North Carolina, and colleagues from Mayo Clinic Rochester and other institutions. Several clinical observations indicate that improved glycemic control may attend the use of tyrosine kinase inhibitors, agents introduced some 20 years ago for the treatment of Philadelphia chromosome-positive chronic myelogenous leukemia. In the present issue of Mayo Clinic Proceedings, Salami et al. Present a retrospective analysis of glycemic control assessed after 1 year in patients maintained on either one of the following tyrosine kinase inhibitors, dasatinib or imatinib. This study involved the interrogation of Mayo Clinic's informatics for integrating biology at the bedside database from January 1994 through December 2019, and had as inclusion criteria the continuous use of either tyrosine kinase inhibitor for at least 12 months and the diagnosis of type 2 diabetes mellitus prior to the introduction of either drug. As compared with imatinib, patients on dasatinib exhibited a 44 milligram per deciliter reduction in blood glucose concentration, a mean 0.80 absolute point reduction in hemoglobin A1C, and patients tended to require less daily insulin. While patients on dasatinib relative to imatinib exhibited a 4.8 kilogram relative weight loss, linear regression analyses demonstrated that such weight loss may account for less than 20% of the reduction in blood glucose associated with dasatinib. These findings are particularly important as they relate to the recognition that type 2 diabetes mellitus may be a consequence of and a catalyst for cellular senescence, and dasatinib is a senolytic, a class of compounds that destroys senescent cells. Cellular senescence describes a specific type of cell fate wherein afflicted cells become cell cycle arrested and resilient to cell death pathways. Importantly, they also exhibit a senescence-associated secretory phenotype, which refers to their production of a plethora of inflammatory and potentially cytotoxic species. These species may exert adverse effects on neighboring cells, and once these species have gained access to the systemic circulation, they may adversely affect cells in distant tissues and organs. Cellular senescence underlies various aging syndromes and predisposes to assorted chronic diseases, including type 2 diabetes mellitus. Age and obesity, conditions in which senescent cells gather in increasing numbers, are risk factors for type 2 diabetes mellitus. In 2015, Kirkland and colleagues at Mayo Clinic discovered senolytics, compounds that kill senescent cells because these compounds vitiate the cytoprotective pathways that enable the survival of senescent cells. Dasatinib possesses powerful senolytic properties, the latter quite weakly exhibited by imatinib. The present findings of Salami et al. Thus demonstrate that for a given class of drugs, tyrosine kinase inhibitors, the use of those specific members which are strongly senolytic, namely dasatinib, are attended by markedly improved glycemic control as compared with those members in which such effects are quite weak, specifically imatinib. These findings invite the speculation that it is the senolytic property of dasatinib the removal of senescent cells in type 2 diabetes mellitus that accounts for the improved glycemic control observed with its use. Geroscience, senescence, and senolytics are exciting, rapidly moving areas in biology and medicine, and indeed dasatinib and other senolytics are currently undergoing clinical trials, including for diabetes mellitus. The first highlight article this month is an original article entitled U-Shaped Association Between Duration of Sports Activities and Mortality, the Copenhagen City Heart Study. It is authored by Dr. Peter Schnoor from Copenhagen University Hospital, Denmark, and colleagues from other institutions in Denmark and the United States. Longevity and health span are generally benefited by physical activity, adequate amounts of refreshed sleep, a Mediterranean diet, freedom from stress, and the avoidance of smoking and immoderate amounts of alcohol. For many of these determinants, a salient issue is how much is optimal, and this is particularly true for physical activity. The study by Schnoor et al. Evaluated the association between all-cause mortality and the duration of leisure time sports activity undertaken per week. This analysis utilized data compiled by the Copenhagen City Heart Study, a prospective study of a population of white men and women, which began in 1976 and involved periodic examinations in the ensuing years. The present study employed data that were collected between 1991 and 1994 and included 8,697 healthy men and women with a median follow-up of 25.6 years. Participants responded to a survey regarding the duration of weekly leisure time sports activities, the latter specifying 10 types of such activities, namely tennis, badminton, soccer, handball, cycling, swimming, jogging, calisthenics, health club activities, and weightlifting. The data demonstrate a U-shaped relationship with lowest all-cause mortality observed in individuals involved in 2.6 to 4.5 hours of such activities per week. All-cause mortality increased in those participants involved with either 2.5 or less hours or 10 hours or more of such activities per week. Moreover, these findings were broadly true for subgroup analysis based upon age, sex, smoking, education, and BMI. In discussing their findings, Schnoor et al. Underscored the following salient points. First, it is unlikely that reverse causality underlies the relationship, as these findings were essentially unchanged when the first 5 years of follow-up were excluded. Second, not all types of physical activity may confer similar beneficial effects, as leisure time sports activity may be more salutary as compared with occupation-associated physical activity, in part because of the social interaction that generally occurs in the former. Indeed, the prior study of these authors in Mayo Clinic Proceedings in 2018 demonstrated that leisure time sports activities that were more likely to confer such social interaction were attended by lower mortality. Third, Schnoor et al. Point out possible explanations for the adverse effects of excessive amounts of sports activities, and these involve cardiac arrhythmias, accelerated coronary artery disease, and cardiac fibrosis. Fourth, Schnoor et al. Upload guidelines that underscore the importance of exercise, such as at least 150 minutes of moderate aerobic activity per week, or 75 minutes of vigorous aerobic activity per week, or a combination of moderate and vigorous activity. However, Schnoor et al. Suggests that such guidelines and recommendations may include a cautionary statement pertaining to the possible adverse effects of inordinate amounts of weekly exercise. Our second highlight article this month is an Understanding Disease article on estradiol as a determinant of the behavior of the renin-angiotensin-aldosterone system. This article is entitled The Renin-Angiotensin-Aldosterone System in Postmenopausal Women, The Promise of Hormone Therapy. It is authored by Dr. Felice Gersh from the University of Arizona School of Medicine, Tucson, Arizona, and colleagues from other institutions in the United States. In recent years, Mayo Clinic Proceedings introduced 3 new sections: Women's Health, the Medicine of Sex Differences, and Understanding Disease. The former 2 sections are dedicated to issues that have long received insufficient attention, while the latter provides discussions of the pathobiology of disease and the biology of underlying novel and emerging therapies. The Understanding Disease article by Gersh et al. Is relevant to all these 3 sections. The central message of this article is one that is poorly recognized, namely, estradiol influences the behavior of the renin-angiotensin-aldosterone system, abbreviated hereafter as the renin-angiotensin system. Gersh et al. Start from the established premises that ovarian function and estradiol production are vital for the cardiovascular, metabolic, and immune milieu that enable fertility during reproductive years, and that menopause-imposed attrition of ovarian function and estradiol production not only vitiates the relative resistance of women to cardiovascular disease in their reproductive years, but it also predisposes to accelerated cardiovascular disease during menopause. The renin-angiotensin system is a key signaling system that is influenced either by adequate levels of estradiol or conversely by estradiol deficiency. Gersh et al. Underscored the following considerations. First, the renin-angiotensin system exists not just systemically, but also locally in tissues. Second, the renin-angiotensin system is composed of 2 arms, one pro-inflammatory and the other anti-inflammatory. The long-recognized classical pro-inflammatory arm is part of the flight or fight response as it generates angiotensin II and aldosterone that, in aggregate, are vasoconstrictive, elevate blood pressure, and promote salt and water retention. Its pro-inflammatory and immune effects are essential in responding to infectious processes. The more recently recognized anti-inflammatory arm of the renin-angiotensin system largely involves the generation of angiotensin 1 to 7 via angiotensin converting enzyme 2. Angiotensin 1 to 7 is antioxidant, vasodepressor, anti-inflammatory, and antifibrotic. Third, inordinate and sustained activation of the classical pro-inflammatory arm of the renin-angiotensin system beyond the period during which its acute effects are needed, or the failure for it to be counterbalanced by the anti-inflammatory arm, leads to cardiovascular, renal, and other diseases. Fourth, estradiol critically allows the pro-inflammatory effects of the renin-angiotensin system to be exerted when they are acutely needed, but it also enables the balancing by or switching to the anti-inflammatory arm and other offsetting processes such that the adverse effects of the renin-angiotensin system are avoided. Fifth, deficiency of estrogens as occurs during menopause predisposes to unchecked pro-inflammatory effects of the renin-angiotensin system, and thus the risks of cardiovascular and other diseases. Sixth, agents, for example, ACE inhibitors and ARBs, that block the pro-inflammatory arm of the renin-angiotensin system may also unintentionally interfere with the anti-inflammatory arm, as these 2 arms are so interconnected. In concluding, Gersh et al. Emphasized the need for more sex-specific research regarding agents that interrupt the renin-angiotensin-aldosterone system, especially in postmenopausal women. And they also outline the potential for beneficial effects in postmenopausal women that may be achieved by synergistic approaches founded on hormone replacement therapy and agents that interrupt the renin-angiotensin-aldosterone system. You can access these highlights and editor's choice articles free of charge during the entire month of December. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. There you'll find links to our social media by clicking the buttons at the top of the home page and at the bottom of any page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, 60 seconds video article synopses, and our Mayo Clinic Proceedings issue summary and author insights podcast recordings, which are available from our website on the homepage as well as through iTunes. You'll also find our online-only feature, Pioneer and Legends in Medicine, which are video interviews of people who've made a strong impact in their field of study. You'll find many news stories posted and news from the editor, Carousel, on our website homepage that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content such as our Path to Patient Image Quiz, medical images, stamped vignettes on medical science, and Art at Mayo Clinic features, as well as articles published online in press. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.